The end of health insurance open enrollment is this Saturday. Now, if you've been putting off your choices for one reason or another, it's time to buckle down and actually get it done. And here to take us back to basics is Blue Cross Blue Shield of Southern Arizona and Arizona Segment Manager Marla Bauer. Marla, thanks so much for being here.
Thank you for having me.
Pleasure to have you. So why is, first of all, for folks who may be wondering, why is health insurance so important?
Yeah, having health insurance is really important. Think about all we do to stay healthy. We exercise, we prepare nutritious meals. Having health insurance is just another component there. So if you're sick, you go to the doctor, you get well, you need to have health insurance.
Well, of course, and this open enrollment period is so important for making changes to your plan or making decisions depending on how your life has changed, because things happen all the time. We change as people, our needs change, and there are some changes here in Pima County specifically that offer different options or more options, right?
Yeah, so the first thing people need to know in Pima County is there are more choices this year for health insurance. Specifically, Blue Cross Blue Shield of Arizona is offering several plans on healthcare.gov for individuals and family right here in Pima County. Secondly, as you mentioned earlier, the deadline is coming up. December 15th is when open enrollment ends for a plan that starts January 1st. It's
funny how quickly that comes, right?
Yeah,
I mean, people procrastinated, all of a sudden it creeps up on them. So this is the week, this is your reminder, sort of get things done, get the ball rolling. Now, are there different steps that people with or without insurance should be taking?
Yeah, there's three main steps. First, go to healthcare.gov.
Yeah.
Look for the plans that are available. They've got quotes so you can see what budget might fit within what you're looking for. And if you already have a plan, as I mentioned, there's new choices available this year. Second, if you have preferred doctors or medical facilities that you want to go to, make sure they're in the plans network. And lastly, if you're on medications, make sure they're covered.
Well, and a lot of what deters people sometimes is the thought of affordability, right? They may have this preconceived notion that it's not affordable. What would you tell those people who think that?
Yeah, budget is extremely important in deciding what health insurance plan you choose. And fortunately, there's financial help from the government to pay for some of your insurance. Some of that depends on your household size and what your household income is. So for example, in Pima County, last year, 73% of those that enrolled on healthcare.gov got financial help.
Wow.
So if you think about a family of four in Pima County who earn up to $43,000 per year, they could be eligible for a $0 bronze plan. So definitely check to see if you're eligible.
Great. And think about the peace of mind that's going to give you and your family too, right? To know that you have a great plan. You're locked into a wonderful care plan that's going to give you what you need, the care that you deserve, etc. And it's important to tell people too that they can't just really sign up for health care anytime.
Right. Yeah, this Saturday, December 15th, is the deadline to enroll for a plan starting January 1st.
Right, the 15th, this Saturday. Put it on your calendar. Do it before then. Don't wait until the last minute, because you know how computers work. They always glitch out, and they're not always your best friend. So, of course, it can be a confusing topic. People need resources. They want to know what they can get, what they can sign up for. What's the best resource for them, would you say?
Because there's only 3 days left, go to healthcare.gov. They've got a ton of information on their website to look at the plans, understand eligibility, and they have people waiting to take your call.
Great. And not only do Blue Cross Blue Shield help us with our healthcare plans, help us be healthier, but also the community involvement's huge. Tell us a little bit about how you do outreach.
Yeah, Blue Cross Blue Shield of Arizona has been in the Tucson community a really long time. In fact, we have an office here that's been open for over 40 years with a staff of 50 people. We are ingrained in all the local chambers, some community organizations such as the Girl Scouts of Southern Arizona, Habitat for Humanity. We host cooking classes at Pima Community College, and you might even find us at your local bashes handing out fresh fruits and veggies. Wow,
just a little bit of everything. We saw some great photos streaming by there of everything you guys are involved in. I mean, we see that shield everywhere. We see that logo so many places. It's so recognizable. I know I've had Blue Cross Blue Shield for most of my life, and I know that I've felt very taken care of every single year through every stage. And like I said, people change. Your needs might change. If something happens to your health and you want to make a change to it, this is that week to do it. Don't let it pass by. And it's very important to get the word out there. So Marla, pleasure to speak with you, and thanks so much for the important information.
Thank you for having me.
Of course. Now, for coverage on January 1st, you have to enroll by December 15th. And for more info on how you can do that, log on to azblue.com.